department. You've received several updates over the last couple of years or so on the EMS study and those recommendations, and you've received some action we've taken on several of those. So I'm just here to give you guys an update on that, and I certainly appreciate your support with EMS as we move through and trying to find ways to improve the services as we go forward. So I certainly appreciate that. The first one I want to go over is the EMS study recommendations on various items within staffing that we've worked to improve. Recruitment and retention is a big piece of that. You've recently approved a 5% pay raise that has immediately impacted our recruiting as applications have steadily improved, and we've seen more and more applications come in, which has all improved our staffing levels as we go, and it's helped with getting more field staff out there. The latest numbers from HR indicate a declining vacancy rate, which means we're on the right track, we're doing the right thing, so thank you for that. Focus on training as EMS captains and administration staff are attending leadership classes. The focus on training is not just about technical, but is also the leadership aspect and giving them the skills they need to do their job. So that is a big piece of that. Community engagement is ongoing with sporting events, town festivals, and the like. That is important that we get out there. We've invented the Bun Fun Day as a part of that. That was a huge event that we took part in, and it was a positive for all the EMS department. We continue to develop, we got the EMS training captain that started on 5/30. That was critical to us to continue to improve operations and find ways to improve and address those recommendations from the EMS study. Developing educational programs for training and continuing education with local community colleges and recruitment within local and surrounding community college EMS programs. EMS staff and I met with Advanced Scrambles representatives and continue to review the programs to support the Franklin County EMS system. The next is the focus on resource utilization and community outreach. We continue to work with the communities such as schools, fire departments, and school skilled nursing facilities, conducting CPR and bloodborne pathogen training. Franklin County continues to listen to feedback from residents as the needs for the programs they are interested in. Utilizing community paramedics for follow-up care and patient outreach is critical to the success of the healthcare in Franklin County, and as the need continues to grow for community paramedics. EMS protocols have been updated with new medications and treatments to better suit our community needs based on quality assurance, identified needs with medical director oversight. And we bring this up because as medications improve, evolve, and the way we treat patients changes and evolves and improves, we have to update our protocols with the oversight from our medical director. So that's a key part of our growth. As part of our capital improvement plan that was recommended from the EMS study, our heat maps support current station locations that are situated in areas of highest call volume. So no significant changes are needed at this time. EMS stations design has been determined. The selection for a Bun EMS station is underway, and locations for other EMS stations are under review. As it relates to fleet recommendations for the EMS study, we have 5 ambulances that we have ordered that are currently awaiting delivery. Those times are we have 2 set for May of 24, 2 for August of 24, and 1 further out in early 2026. The rotation of existing ambulance fleets based on vehicle mileage and shift trends. So as we get busier and busier with certain districts, we swap those trucks around so to keep the mileage down as best we can. We address that on a dynamic basis. Since the EMS study was conducted, 4 ambulances have been placed in service and maintaining an up-to-date fleet focus on safety and reliability. The fleet is critical to the services of the EMS department. Here's a small snapshot from January to the end of March of this year related to call volume. As you can see, the peak hours are approximately 8 a.m. to 9 p.m. During that time frame, about 74% of those calls are during that time frame from 8 to 9. They vary from transports, non-transports, and other dispositions. And just to give you an idea of transports are more of a traditional situation and how that transpires a normal call and we respond. Non-transports can be several things, but typically those where they're refusing transport, they sign off on it and we go back to get in service. And other dispositions would be if we were to go to the call and we can't find a patient. There's several scenarios there, but that's the main thing, we couldn't find a patient. So just in case, if you're wondering about that. And to address that peak demand that we have from 8 to 9, we've assigned yet another truck and crew with FY24 budget that they've already started recruiting for and have been conducting interviews. And again, that shift will be from 8 to 8 to address that on a 12-hour shift. So I hope that gives a little bit more insight into what's going on with Franklin County EMS and what we're trying to do to address those EMS study recommendations. And I'll be happy to answer any questions.
All right, thank you for that, Mr. Preble. Any questions from the board tonight?
I got one question. Comes from the public comment section, and plus I've heard of it. If you get somebody, pick somebody up, and their doctor is at another location other than here in the county, what is our protocol on that? Do we react to that? If they gotta go to Duke or
So we want them to come to the closest appropriate facility. That's what we want to do. And that's all based on the acuity of the patient. In other words, what they're experiencing at that time, what their symptoms are, what care they need. And we base it on that, and that's what the crew does.
when you first pick them up, you
Yes,
do
sir.
that evaluation?
Correct.
If you find out later that their doctor or their primary care person is at another location, does that come into effect, or?
We document and follow up with them, yes, that's correct.
Okay. And I can see the connection, you know, if there's got a heart doctor that's assigned to them, to get them to that.
Right.
My other question, I know we were going through this responder situation, and I was just wondering how we're coming on that.
Okay.
If you see any completion on that in the future, or?
So we're working through some questions and concerns and I'll say challenges we had with other fire department agencies. And we've made some progress with several of those, and we continue to work through those as we go. It's not a one-size-fits-all for all the fire agencies, so we each kind of have to tailor what the needs are and address those as we go. We are making progress on that.
That's good. Thank you.
Okay. Any questions?
Any other questions regarding